Hi, everyone. My name's Sam. I use she, her pronouns. I'm the worldview organizer with Citizen Action. It's been great to see everybody throughout these past few weeks for our legislative teach-ins. This is the final legislative teach-in of the series. We've been doing these as a way to prepare for Lobby Day. Lobby Day is February 16th, and this is when we're going to be talking to legislators all across the state virtually to push our values, to make sure that our justice agenda is being heard and that we're speaking for all New Yorkers, right? So we're going to get into it. I won't hold us up anymore, except for one other thing. I will be watching the chat and I will be sharing my screen. So if there are questions, you can use the raise the hand option or you can put it in the chat, but we'll have space for that for sure. And then at the end, if we make it all the way through the material and we get to the end, we're going to do a 10-minute breakout about our value statements like we've been doing at the legislative teach-ins. Just coming together in a group, talking about how to say what we believe in and how we would bring that to our lobby visit. So thank you so much for being here. Like I said, my name is Sam. And I'm going to pass it over to Bob Cohen. He is the Research and Policy Director here at Citizen Action and knows everything healthcare and everything climate. So I will be sharing my screen and I'll pass it to you, Bob.
Yeah, could you pick it up? Yeah.
Hi, everyone. So I've already been introduced. I do want to say just a couple of things before I start. My goal is to talk no more than like 20 minutes or so. I tend to talk a lot. So hopefully I'll achieve that goal. So we'll have some time for questions. I also do want to say a couple of things. This is not like despite my title, a detailed policy kind of briefing on, you cannot do this on our program in 2 areas in the time I have. So I'm not going to spend more than maybe a minute on why climate change work is important, why healthcare work is important. We do things like that, and we're open to doing, a more detailed thing. Nor is it like a full lobbying training, which is very practical. But the one thing I do want to say is sort of to reassure you, everyone, which is that there are information sources that we will have. I believe there's going to be a more specific Lobby Day training, or maybe it's being done on a chapter level closer to the day, which we can literally go over the visit, how you conduct it. It has a style. So please don't be nervous if you don't, when you're done in 45 minutes or whatever we have, that you don't know exactly how to handle it if you haven't done this before. This is just giving you a flavor for the issue and a flavor for lobbying. That said, I'm going to start. And Sam, one other thing I was going to say is I'm terrible at multitasking, so definitely tell me if there are questions in the chat or comments.
Okay.
Thanks.
Perfect.
Okay. I'll start. Our topic here is climate and healthcare justice. They are connected, but quite honestly, the main connection is we didn't want to do that many trainings. So these are 2 from Citizen Action's perspective. These are 2 of our major issue areas. So we thought we would do 2 tonight. Next slide. Oh, I should also say that, I'm sorry, it's on this slide. As people probably know, if you've been involved with Citizen Action or have been to another training, our justice agenda is a new, exciting concept. Citizen Action has been trying really to integrate all of its work in various ways, including the trainings that Sam and her colleagues do. And one of the things we're doing for the first time is integrate all of our issues in a kind of unified way of describing it so that we can get out our messages effectively. So this is the sort of simplified agenda we have in our justice agenda for climate. Really briefly, we believe everyone deserves to live in a healthy and resilient community, protected from extreme weather and pollution. So we must, and the next few things are a brief summary of what we're for: eliminate greenhouse gas emissions that cause climate change, transform our state to a renewable energy economy, prioritize Black, Brown, and other vulnerable communities that have suffered for disproportionate effects of the climate crisis and pollution. So the test of whether we're being successful in integrating our work is the material that I present to you next few minutes, consistent with these statements. Hopefully it will be. Next slide. So really briefly, like this is like climate change 101. The real central problem, as people probably know, with climate change is really, and sometimes called global warming. I won't get into why you use one or others. Is that as the sun heats the earth, various gases called greenhouse gases. Sometimes people say it's carbon dioxide. That's just one of them. Another well-known one is methane. Are trapped in the atmosphere, therefore warming the earth and warming, our atmosphere, which causes numerous consequences, such as storms, extreme weather events, rising sea level, floods, etc. And the consequences to our lives are enormous. We're talking about the California wildfires. We're talking about Storm Irene and Sandy in New York State. We're talking about melting of the polar ice caps. And we're talking about entire islands in the Pacific, nations no longer potentially existing because of rising sea level, and many, many other things. So I think people here know the consequences are dire to our civilization. There have been international reports, the most famous called the Intergovernmental Panel on Climate Change, that its most recent analysis predicted dire and cataclysmic consequences if we do not achieve not having an increase in global temperature of 1.5 degrees centigrade. If we don't stop that from happening in the next couple of decades, they predict even more dire consequences than we're already experiencing. Next slide. So this slide really just shows, some of the clips. We could have done 50 more. The consequences to us of climate change, and I've just, for reasons of time, I'm going to focus on the one on the left, which is 2021 was the Earth's 5th hottest year. And you could expand that and say, and I'm not one of these people who has memorized every statistic in the world, but it's something like, of the last 8 years, something like 7 of them have been among the hottest. So this is the world that we're going to experience if we don't address climate change. Next slide. So the other thing to know, climate change 101 is, don't let the corporations fool you. Technology is available now to make the transition. It's not what Bob Cohen, an anti-climate, a climate activist, has said. This is what New York State has said in its big plan, called the scoping plan, which I will discuss in a minute, has said. This is what New York State's conclusion is. This is what really all scientists have said. It's a matter of political will. It's a matter of overcoming the opposition, both of people not believing it, because there's a lot of distortion out there by the right and corporations. And it's a matter of people frankly not wanting to spend the money or corporate interests benefit from the existing system. And not just corporate interest, legitimately people like workers who have jobs in the old system, don't necessarily want to change or have fear of change. Okay, next slide. Citizen Action does its work through a number of coalitions. We are multi-sectoral in terms of our issues. We're also try to involve ourselves with many other coalitions. We work with partners we think it makes us effective. We want members like yourself to be active. We do things on our own, but we know to impact an issue this important, we have to have work with people of all walks of life. NY Renews and its webpage, if you haven't seen, their great webpage is on the lower right hand of your screen, is a truly unique coalition that was formed a few years ago. It has over 300 member organizations. The reason I call it unique, is because I think the main reason is we're trying to encompass so many different interests. There's the traditional environmental groups, which it's a stereotype, but it has some truth. At least the mainstream environmental groups that are traditional have tended to be white, middle class, or affluent. Not always, but certainly there's some truth in that. Doesn't mean they don't do good work, but their approach is very safe and tends to be not involve low-income people, communities of color. And then we also involve traditional community groups, community organizing groups like Citizen Action, political parties like the Working Families Party, faith groups are all part of this coalition. And I would say of the 5 bullets you see there, which I'm not going to read back to you, to me, the most important one of all is the one in the middle. We can address both the climate crisis and the inequality crisis together. We mean that. It isn't just rhetoric. You will see that the program we advocate both incorporates addressing greenhouse gases, which are critical to climate change, and doing economic transformation as we move away from fossil fuels to a renewable energy economy. We want to make sure that renewable energy economy works for everyone. Next slide. Should I stop to see if, have there been any questions, Sam?
Not in the chat so far, but we can ask, does anybody have any questions off of that info so far?
Look at that slide for a second. Again.
The back slide? Yeah. Oh, let me try. I was going to say it's a little video, so it's going to make it difficult for me to go back. But somebody asked, is the Dem Socialists of DSA part of the coalition?
I'm sorry, I didn't hear that.
Oh, sorry.
Was the question?
Is DSA part of the coalition of NY Renews?
So whoever asked that, definitely, if you could in the chat and Sam, if you could record that, I will respond and confirm this. But I believe that DSA statewide is not. But as I understand, DSA is pretty decentralized, so there are some chapters that are.
Okay, thank you.
I believe that's right. If I'm wrong, I'll email you and clarify that. You can also go on their webpage, nyrenews.org, which lists all the organizations. Yeah, thank you, Greg, for putting the link.
Green housing. Like really, like dealing with unhoused people and actually building housing that is really actually not just sustainable, but actually proactively green, as they would call it these days.
Yeah, and as I'll get to in a second, really the transformation we need is really everywhere in the economy, but certainly housing and buildings is actually, you could argue, maybe the most important. Green building emissions are the largest source of greenhouse gas emissions, but we also have to work on all of them. Next slide. Oh, we were going to try to, this video is amazing and I didn't do it, so I'm not complimenting myself. It's about 1.5 minutes long and it explains both, I should just say, another coalition can't wait, which I want to briefly introduce, is yet another coalition that formed this year and is going to be doing larger mobilizations, including one around Earth Day. We'll set the date soon. And has as the video says, a list of bills that we're advocating the legislature do. So without further ado, I'm going to have Sam try to play it. It's only about 1 minute long.
In 2019, New York State passed a landmark climate law, the Climate Leadership and Community Protection Act. The CLCPA set ambitious goals to cut greenhouse gas emissions, zero carbon electricity, create climate equity, and protect workers' rights. But it's been 3 years, and New York is failing to meet these goals. This summer, climate-fueled hurricanes destroyed homes and lives across our state. Climate can't wait. It's time for Governor Hochul and our legislators to take a stand and pass significant climate legislation this year. New Yorkers from more than 30 organizations and grassroots advocacy groups are coming together on January 25th to demand real climate leadership from Albany. We've got a slate of 12 powerful bills that Albany can act on right now. We need green energy, climate equity, green jobs, and green homes. Join us to fight for the future we all deserve. Climate can't wait. Join the movement.
So I think, and by the way, that was done by a volunteer. I think they did an amazing job. I wish I could say that I had done it. And it does explain briefly the Climate Leadership and Community Protection Act, which I'll go into. But just briefly, it's the climate law that passed in 2019 that a lot of our work is based on. And I also just want to say, when the video, the narrator was referring to January 25th, he meant a couple of weeks ago. We had 3 different events. I'm sorry, 4 with several hundred people, and it would have been far larger, except COVID, the latest version of the virus, caused us to suddenly cancel our big event that we were going to have the 25th, but we did have smaller socially distanced events in several places. And as I said before, we plan on having a much larger event in April. Okay, next slide. New York Renews is a member of Climate Can't Wait, but is focusing on its own agenda as well, which I will talk about in a moment. What is the CLCPA, which was mentioned by the narrator? It basically has 3 ideas in it. One is, as I said before, we need to reduce greenhouse gases that cause climate change. Those greenhouse gases, those mandates, and the most important one is an 85% reduction in greenhouse gases by 2050 are across the economy, meaning, as we spoke about a second ago, we have to regulate buildings. We also have to regulate transportation, power generation, you name it. That's the only way we're going to achieve it. But what you need to know about that is that means we're going to have multiple state agencies and other institutions working together. It's a very complex process. The goal is 85% by 2050. Second, 40% of funding for communities who are low income, vulnerable to climate change, and those who would benefit most from things like weatherization, energy efficiency, and electric buses, they must receive 40% of the funding. That needs to be worked out, and that we're in the process of doing that now. The next thing is climate and equity screens, and briefly, when a new project is proposed in New York because of the CLCPA, that's the only acronym I'm using because it takes so long to say that. Climate Leadership and Community Protection Act, CLCPA, same thing. In what the CLCPA requires is that if a new project is built, the state agency that builds that would normally approve that project has to consider the impact on communities of color, low-income communities, and has to consider the impact on the climate. That's basically it, and it gives us a vehicle to stopping or hindering or improving or ameliorating the worst impacts of a fossil fuel project, although not necessarily stopping it. Like many of us think none of them should be built, but at least it makes it much harder to build. Next slide. So I see one question by Ashley. Does the water sewage systems impact climate? You could claim technically everything does. I will say this, that I'm sort of ducking this question a tiny bit, but let me put it this way. Anything that releases methane or greenhouse gas would potentially do that. And certainly landfills do. That's actually a big aspect of it. I haven't heard about specifically sewage. So, you might want to contact me offline and I'll be happy to sort of track down an answer to that. So the next slide says implementation of the Climate Leadership and Community Protection Act. What do I mean by implementation? Well, very simply, when the legislature passes a law, as it did in 2019, it doesn't magically become legally effective. What happens is you have to put in other things in place usually called regulations that allow state agencies to be able to basically penalize businesses, or it could be individuals, who don't comply. So that, it turns out, is a really complex process in the case of the CLCPA, because, as I said, we're regulating almost everything in the state's economy. The way it works and the way they're doing it, and the important thing to keep in mind is to hopefully people will think about how you can impact this yourself with other people, because we will have an impact like with everything else if we organize. But the administrative bureaucratic process, which I hope I don't put you to sleep, but we need to know some basics of this, is they formed what's called the Climate Action Council. You'll see that on the left, the great graphic our staff has done. Basically, of all the major state agencies meet in a council, plus some public members. Some of them are very good, are friends of ours and agree with us. Some of them are not so good. One of the oil industry people is on it. So those folks are coming up with, in fact, came up with on January 1st of this year, what's called the draft scoping plan, which has detailed recommendations, or at least in theory, it should have detailed recommendations. That's what it was supposed to, of what to do in transportation, what to do in local government, what to do in energy efficiency, so that collectively we would get to that 85% goal. And then last but definitely not least, we used to put pictures of Governor Cuomo in our PowerPoint so we could have booing, is Governor Hochul. The governor in New York State is basically the boss of all the commissioners. So when you talk about community organizing and you talk about targets, that's why we target the governor, because ultimately she is responsible. If the Department of Transportation commissioner doesn't do his or her job, she can fire them. So that's why the governor is the major target, although we will be directing a lot of comments to these agencies. Next, please. So one thing we're doing this year, which is not about lobbying, but I thought it was important to mention it because it's so key to what Citizen Action is doing. You will be getting emails about this soon when we have more definite things like when the hearings are that are scheduled on the scoping plan. But now I'm going to get to our legislative agenda. The most important thing we're going to be advocating for this year is, as it says here, since all families deserve clean air, clean water, and safe homes, and climate protection against climate change, we are asking for a $15 billion investment. That's state money that funds a number of things that are listed here: household efficiency programs, climate jobs and infrastructure, funding for local renewables, green jobs, and work with transition. We can fill in more details at some point, but this is sort of an overview. But the idea is that this is very simply, the state must spend money, otherwise the CLCPA becomes a paper tiger. Yes, the private industry is moving in directions to address climate change, but it isn't going to happen. We know the history. We know private industry has been polluting for years. They are not going to make changes unless government induces them to do it. And that means through investments in electric cars, investments in building charging stations, etc. So that's what our goal is this year. Next slide. Our big bill, which is our really aspirational thing that, quite frankly, we think it's going to take a while to get passed, but we're still pushing it, as people have heard, is to pass the Climate and Community Investment Act. You see the bill numbers listed there of this legislation. Will actually do something pretty similar to the $15 billion, which is it provides a permanent funding source for climate transformation, which will be spent in the ways that I just listed and also listed in this chart. So the way it will do it is by establishing a polluter fee on, for example, people who transmit fossil fuels or dig up fossil fuels in the state, etc., and will raise billions of dollars every year. For people who sometimes say, you know, boy, we don't want to raise taxes that much, or question it, what we say in response is, lots of studies have said that the benefits, and again, New York State has said this in its scoping plan, billions and billions of dollars. New York will be repaid many times in the form of greater health outcomes, less pollution, better housing, better quality of life, you name it, if we make these changes. We all know the dangers, the cost to people and government of the storms, and you know, Paradise, California was burned to the ground. That cost a lot of money. Next slide. I think, Sam, do you want to take over at this point? Just this slide at least?
I had a question here.
Nope.
Sure.
Yeah.
Okay, so the $15 billion, that one is to cover what duration of time?
Excuse me, what?
Okay, you said you're asking for $15 billion towards climate change. So that
Yep.
one is to cover what period of time? How many years are we looking at?
Oh, I'm sorry, the $15 billion, good question. The $15 billion is for this year. So this is our budget asked for the 22-20 budget year.
Okay.
That starts in April, but we are assuming that we will continue to need this money for, I don't think anybody's projected how long, but certainly a number of years it's going to happen. I mean, just think about it. We've got to use one example, we need to replace all boilers in New York State that heat homes by oil and gas. That's going to take years. We need to redesign buildings in the state. I forgot the number, but it's, I believe
Yeah.
we have over 1 million buildings in the state.
Yeah,
So
it is a continuing process. Yeah.
what's that?
Yeah, you're right. It's a continuing process. It's not 1 year, 2 years, it stops. It is something to keep going.
Yeah, I mean, certainly probably to 2050 when we think we will achieve this 100% renewable energy economy. I think German was asking
Yep.
a question. Go ahead.
Hi, good evening. How are you?
Good.
Based on the presentation slide, when it mentioned about healthier neighborhoods, my question to that is, which neighborhoods are you referring to? Is it within New York City or within New York State?
The entire state. This is
state.
legislation. So
Okay.
we're talking about everywhere.
Everywhere? Okay.
Everywhere in New York State. And we would include in that old towns too. There's lots of rural towns where they don't really have neighborhoods like we think of who live in the city.
That's where I'm at.
Right, because the reason why I asked that question is because in my neighborhood they need more of the composts around the garden that's next to my apartment building. They need
Mhm.
more composts. You know, in order for the garden to grow its flowers and weeds and everything else. That's all I wanted to ask.
Yeah.
Thank you.
So, and by the way, I don't want to give anybody the idea that anything that you can imagine needs done is necessarily will be able to pay for. But the basic idea, the structure of the CCIA, the Climate and Community Investment Act, one of the provisions of the bill under the billions that it would raise would be allow community groups to write grants, and a state agency would basically determine which are the best ideas, both from the perspective of community needs and reducing climate. And some of those would be funded, but we definitely have to look for multiple funding sources, including private, to address a lot of these
Yes, sir.
concerns.
Yes, sir. Yes, sir. Thank you.
Sure.
Yeah, so I'm just going to read these value and vision statements here, and then we're going to move into the topic of healthcare. So reading these out loud, so we can practice and recognize what this vision looks like, right? That together we can build safer, healthier neighborhoods, strengthening our local economy, and improve the quality of life for our children and families. We have a responsibility to prioritize the well-being of our communities by encouraging the transition to clean, renewable energy. We have the solutions that will make life better for all of our families. Now we need the political will to implement them. So like Bob said, right, there's the technologies, there is the capabilities, we just need the political will. So I'm going to move it back to Bob, and I believe we'll go into healthcare.
Yep. So I'm going to do the same thing for healthcare as I did for climate, but perhaps hopefully a little faster. These are, I want to say again, these are vast areas. So I'm sure you're not going to become a healthcare expert or a climate expert from this, but this will give you a sense of the kinds of things that you can be talking about during our lobbying visits. Healthcare, this is Citizen Action's Justice Agenda Statement for healthcare. Healthcare is a human right. That's what the most important thing I could be saying. So we must provide quality coverage for all necessary medical services with no out-of-pocket costs, ensure quality care for every person, and end healthcare discrimination, and end abusive billing and collection practices. And again, what I'm going to be talking about, which is both the policy part, the bills we're doing, all will flow from these ideas, hopefully. Next slide. So I just wanted to say that it's important to know what citizen action is about. Citizen action started out in 1983, and probably one of our main two issues was healthcare. Some people considered us a healthcare group. Now we are much broader than that, but healthcare is still a critical concern, and citizen action, along with a lot of allies, has played a role in a lot of the state reforms that happened in the 1980s, mostly the 1990s, I would say, and 2000s, that expanded healthcare on a state level on an incremental step-by-step basis. But the big thing we did on the federal level, along with obviously thousands of other people around the country, is pass the Affordable Care Act, which in progressive circles, we call it Obamacare. We don't say that much publicly, but some people know it as Obamacare. It was the main law that expanded healthcare that did it since 1964 with the passage of Medicare and Medicaid. Very, very important. A lot of people, including me, have critiqued it, but it made a lot of gains. For example, it prohibited, there's so many examples I could give, but one example is that it stopped the insurer's practice of not allowing people with pre-existing conditions from getting health care. In other words, in simplest terms, even if you're sick, you're entitled to insurance. That's the point of it. And that's one of many things Obamacare did. The other thing that I want to mention, because it may affect people is it created these state exchanges. In New York, if you want to look it on the internet, it's called New York State of Health, that enroll people who don't have employer-provided coverage or other forms of coverage, say they're between jobs, with healthcare. And it's a really important role. It's enrolled millions of New Yorkers, although as you see, we have a long way to go. Next slide. These are 3 coalitions we work with. We're involved with all of these. Campaign for New York Health, which focuses on New York health, and I'm going to get into that in a minute. Healthcare for All New York, which has a very wide agenda. Coverage for All, immigrant coverage. All of those I'll cover in a minute. Next slide. This slide is some of the problems that are remaining in healthcare in New York, even though we passed the ACA. I know everybody here has healthcare problems or knows somebody who does. So I'm not telling you anything you don't already know, but we hopefully put it in a succinct way so you could see it. 1 million New Yorkers are still uninsured despite the Affordable Care Act. Affordability is a problem even for those who have insurance. These are the kind of things you need to tell legislators. Some of them know it, some of them don't. But there are abusive billing and collection practices like hospitals suing people, including nonprofit hospitals, which cause people to have further federal debt and causes umpteen problems for people, such as inability to buy a house because they have bad credit, because they lost a lawsuit. Healthcare discrimination is real. And when we say discrimination, we mean by a number of things. But, the 2 I most had in mind is discrimination based on race and based on geography. I think Yvonne had a question. And by the way, I can only see like 4 different people. So, Sam is monitoring it. Apologize if, it takes us a second to see somebody has a question. Yvonne, do you have a question? I'm not sure, your hand is on your thing. I'll go on, and maybe it was accidental. Oh.
She's saying she can't unmute. I know, Yvonne, you did mention earlier. I'm clicking, I asked to unmute, so you might be prompted. If you want to put your question in the chat, I can read it out loud.
Okay, why don't we go on, because we have issues of time, and if you could put it in the chat, Sam.
I'll
will-
read it out loud.
Okay, so next slide. Okay, I'm gonna do, so we're gonna go through each of these things with a little bit more information. The first thing we said is 1 million New Yorkers are uninsured. So, I'm just gonna pick some of the key things in the chart. The biggest number, if you see there, is 21%. So what, roughly 1/5 of those 1 million New Yorkers are people who are not citizens, sometimes called the undocumented. That is very simply why you will see that one of our priorities is healthcare for that group of New Yorkers. If you look on the lower part of this chart, you'll see that certain New Yorkers, in this case, Hispanics in particular, Asians, have higher rates of uninsurance, which is a term I don't like, but I use it out of habit. They have less insurance, so that obviously affects who we need to outreach to, and also in some cases, we have to design our programs to meet the needs of those categories of individuals. Next slide. Affordability is a problem even for those with insurance. 45% of New Yorkers avoided healthcare certain decisions due to cost. This is seniors splitting their pills. This is people not going to the doctor. This is people delaying going to the doctor, et cetera, et cetera, et cetera. It's, to me, a shockingly high number, but this is a survey that was done recently. Next slide. So I already mentioned about abusive billing and collection practices. I could go on for like a half an hour what they are, but I won't. But one of them is, one indication of it is somebody was able to do a study of the share of residents who had delinquent medical debt on their credit reports. And as you may know, you only get listed on your credit report if you don't pay for a period of time. So these are people who are real behind in their medical bills. And you see that the numbers are very high, but particularly they're high based on factors like race. So Westchester, so where you have some of the wealthiest and among the poorest people in New York State, you have a 370% difference between communities of color and whites in terms of the percentage that have delinquent credit card. So this is two things we're talking about. We're talking about both the number of people in medical debt and how it breaks down by race, and you could do it by other factors as well. Next slide. Healthcare discrimination is real. I think this is probably what everybody has read in the paper. At the height of the pandemic, mortality rates were 3 times higher at underfunded hospitals, which means hospitals in low-income neighborhoods, places like in various parts of Brooklyn, than at wealthier hospitals in New York City. Next slide. So, so this is basically, and I'm going to skip through it, a quick bumper sticker message that we need to organize, and we need to respond to that through lobbying. And if I had had more time, I would have said, when we lobby, we win. When we organize, we win. Lobbying is just a piece of what we do, but it's what we're focused on today. Next slide. So this particular, so what are the bills that we're working on? And we will have more details on lobby day. First is passing the New York Health Act, so-called single payer. I think people probably have heard of that. It's been in the paper a lot. And what the New York Health Act briefly does is it replaces the existing system. It's really radical, and tremendous in terms of what it would accomplish to establish one system where nobody has to pay premiums, nobody has to pay out-of-pocket costs, and essentially we pay for our healthcare through our tax dollars. That's really the concept. It puts everybody in an equal plane in terms of income, health, and other status. Next slide, because I want to contrast it with another thing we advocate for.
Whoops.
I'm sorry. Whoops. So the next major thing we're advocating overlaps with New York Health, where for both, as is the Campaign for New York Health. I was on a conference call today with the head of Campaign for New York Health, where she was lobbying with this with me. And we also were supporting the Campaign for New York Health bill. So we're for both. Is we are trying to cover those immigrants, mostly the undocumented, but there are others too, who were left out intentionally of the Affordable Care Act because of their immigration status. They are folks who contribute to our economy. As we all learned through COVID, they're often are frontline workers. They're often people who contribute and do the dirty work, the work that other people don't want to do. They pay taxes in most instances, and yet they don't have the full benefits of our society, including coverage. We want to stop that. And we have legislation that would cover all of them in a program similar to New York's landmark, what's called the Central Plan. And what the Central Plan does is it covers people right now just above the Medicaid level who and gives them comprehensive coverage with no co-pays, no premiums, extremely low co-pays, no premiums on any income level now, and comprehensive coverage. That's what we want to do. And we're doing it with a large coalition called Coverage for All. Next slide. So in addition to our coverage agenda, we have 3 bills that deal with the issue of medical debt. We could have 30. I mean, I have to tell you, it's a very complicated area, but these are the ones that we have focused on because they're the ones that we've identified as being particularly important. I've listed the bill numbers in the bottom. We'll be giving you handouts, but essentially what it deals with is improving the financial assistance system in New York. So right now, low-income people can get hospital financial assistance, but in many cases, they're not told about it. The forms are not standardized. We want to standardize the forms, et cetera. So we want to make sure that that system is available to more people. The second one, oh my God, this is arcane, and I'm a lawyer. It gives me nightmares from law school. But essentially, if you lose a lawsuit, which most people do in medical debt, you get sued by a hospital, you do what's called default, which means you don't have a lawyer, you don't know what the hell this summons was. So you lose the lawsuit. The next thing the business, the hospital or the doctor does is garnish your wages, which means a piece is taken out of your wages. And we don't think that that's acceptable for medical debt. So that's what that bill will do. It would protect thousands of people. And the final one is hospitals have this lovely thing they do, which is if you or family members been to the hospital, you probably know this. They charge you what are called facility fees, which is a fancy way of saying they're going to throw in a fee for nothing. So the analogy I used to do consumer protection, I always tell people is like when you buy a car, do they charge you a fee for going to the showroom? No, they charge you for the car. So it's unacceptable, and they do it. We want to at least ban it for preventive services, like, for example, mammograms. That's one way they gouge a lot of women is they claim you're going to pay X for a mammogram, but then they throw in another $300 quote facilities fee. Ridiculous and deceptive. We want to ban that. Next slide. So the final one, there's a lot of words down here, but I'm going to just say it basically. New York State allocates $1.1 billion to hospitals for what's called an indigent care pool. What a terrible term. Indigency means being poor. The idea is hospitals are supposed to help poor people. That's why, you know, if somebody is shot or something, they're obligated, the ER.
Who is it?
Oh, I guess that's somebody else. If you are, you know, shot or hurt and you don't have the money, hospitals in New York State, because of the indigent care pool and federal law, are required to care for you, for your emergency services, whether you have money or not. So we give them money to help people, lots of money for those services, to perform those services. And yet that money is not in any way or very little directed to hospitals that most serve low-income people and people who are not insured. So, and the hospitals are fighting that because they want money for just being hospitals. So what this legislation would do is direct a higher percentage of the money for hospitals that actually serve low-income people. So this is switching the money, sort of like if people have worked on school aid for us, you know, the AQE, it's the same idea. We want to give money intended for low-income people for low-income people, in this case for healthcare. Next slide. I believe we're up to your part, Sam, but I could be wrong.
Yes, it looks
yeah.
like it. I do wanna, Yvonne, I saw you logged out and came back in. So if you're off mute, please go ahead with your question.
I had to log out and then log back on. My question is there any state law specifically for like an inmate, regardless if it's an adult or a juvenile, to like where they have to receive immediate medical care?
I'm not an expert in that kind of area. I know there is a system, medical system for inmates, you know, doctors there, which I'm sure you know, but I don't know. I've never been asked that. You know,
The
I don't
reason
know.
why I asked that is because NAP care gives it the inmates and the juveniles their medical and mental health care, regardless if it's a local city, county facility, or juvenile detention center. NAP care was recently, they did a settlement with the Department of Justice with the US because they was caught and they submitted false claims worth $674,000. That's almost $1 million that taxpayers came out of their pocket for. And they're still giving us our medical treatment. And in my city I live in Syracuse, and we had 3 people die within 1 year last year, all from suicide.
Well,
And I've looked up and I tried to see if there's a law that would require either giving us immediate medical attention during an arrest or as soon as we get there to the facility.
So I have to say, healthcare is like a really complicated area. What I'm going to do, Yvonne, is I don't think that this is on the slide, but I will, for everyone, put my email, and I'm also on the Citizen Action webpage. But please, feel free to email me, and I'll track it down. I don't know everything in healthcare, but I'm connected to a very large network of people who do this, and I'm sure I can get somebody who'll get you an answer, because it's certainly not an area I've ever personally worked on. Sorry.
No, that's fine, because when okay, when we go, for example, I got arrested in September. I told them I got hurt during arrest. That's one law agency who's arresting me, and then they take me to a different law agency. They're not corresponding with the law agency. So sometimes it takes us inmates here inside Syracuse and Onondaga County 2 days before we even see medical attention. And ultimately, you have minorities killing themselves inside our jails.
So the one thing I could say again, so let me tell for everybody, my email is bcohen@citizenactionny.org. So it's bcohen@citizenactionny.org. I put it in the chat. So the only thing I can say on that, and I know I'm not directly answering your question, is that we have an incredibly fragmented system of healthcare in the United States, depending on what your category is, your status. And a lot of what we do as advocates is try to give sort of a uniform level of care depending on what your status is. But that's yet another example of how we have a long way to go. And by the way, I'm a passionate supporter of New York health, and but I don't want anybody to think that having New York health is going to solve problems like what Yvonne is talking about. All New York health does, which is great, but it gives everybody right to insurance, but there's so many other problems. And some of them we mentioned today, about the delivery of healthcare in New York State and the country. Yeah. And
ultimately, it is the delivery of healthcare, because there's some people who are like either dying or taking their own lives. And like you said, it is the delivery of healthcare. If you go to jail, they treat you as an animal. So that's the type of healthcare that we get.
Yep. Nope. I take your word, but I'm sure that's true.
Thank you. And again, so Bob's email is in the chat. Please write it down while it's still there. And follow up, and y'all can kind of connect on this. And I think if there's anybody in the chat who has any resources, please put that into the chat too. Share what you know here while we're all together in this space, because many of us are coming in with activism or with being like having lived experiences that we can share. So please do that. So thank you, everybody. We are actually past time now, so I don't think we'll get to our activity, which is what we've been working on within all of the teach-ins, where we kind of center practice value statements. So I'm just going to share this information about lobbying day, and then I think we'll go to 7:35. So about 3 minutes left of the night, but it is a little bit past. So this is, I'm putting in the chat right now the link to register for Lobby Day. This is when we, the people, come together to lobby elected officials and to show that what we care about, and push our justice agenda forward. This is going to be February 16th. It's in the afternoon. It's virtual. And we want to let legislators know that we need universal health care and a real climate investment this year. So instead of going into groups and practicing, coming up with a value statement, I thought that I'm going to go all the way. Oh, Emilia, do you want to share really quick before we go into our next thing? What I think I'm going to do is have us all come off mute and just share and read this first value statement out loud that's on the slides right now. But Emilia, if you have a thought or a question before we do that.
Yeah, just quick. When we were discussing everyone deserves healthcare and how the impact of everyone, including immigrants, the fact is that whether or not they're paying taxes or working or part of the economy, we have seen through this pandemic how if one person is unhealthy, everyone else is affected. And with a pandemic specifically, how disease harms everyone, and but also things that are not contagious can harm everyone. So, but this is a very prime example with the pandemic, and I think we should use that.
Thank
I-
you. You're right.
Totally agree.
You're right. So I think we together maybe, oh, David, you have a question? Go for it.
Actually, it's more of just a general statement about how we're our country and our state. It's just so behind the rest of the Western world when it comes to healthcare. I mean, we have little elements of it. I mentioned in my comments, I'm a veteran myself. I'm fortunate enough, I have a service rated ability, so I don't have any healthcare costs within the VA system. That's a model right there for like an NHS style system, or north of the border, Canada for decades. It's insane to me that we're not there. It's just insane. And it's like, it's because insurance companies say, it'll be obsolete, and it should be obsolete. Just like in climate change, that should be obsolete. I'm sorry, it's just a statement I wanted to make.
No, thank you so much. And I feel what you're saying. I see Bob shaking his head because I'm right. This is the conversations that we have. And it's so important that we join together to talk about these issues that impact everybody's daily lived experiences, right? And the reason that we want to come together is to make sure that we're building our power and we're showing up for each other, for everybody, for all New Yorkers, right? So to do that is why we're having our lobby day, because it's one thing when we're talking together in our committees, it's another thing when we're telling our legislators and we're pressuring them and we're showing up to hold them accountable, right? Because if they're not hearing us, right, the next thing we know, we're going to make sure we get somebody else in their seat. So those are the things that are important. We need to show the things that are important to us. Like I said, our activity, we won't be able to do the breakout rooms just because of time constraints. But what I want to do is, one, thank everybody for coming. Again, the registration for the lobby day is in the chat, but I think last thing before we go is I want everybody to come off mute. We did this in the housing, oops, there's somebody right now that just not yet coming off mute. So we're going to come off mute, and together we're going to read the first statement, and that'll be how we practice our value statement. And then I'll say thank you, and we'll say good night. And yes, we're going to try to figure out how to get the slides to everybody within the next few days.
Oh, good.
Okay, so just so everybody come off mute, and then I'll count down to 3, and we'll read that first bullet together. Okay. So 3, 2, 1.
Together we can build a
Build safe,
healthier
strengthen our local economy,
Local
improve
economy.
the quality of life
for
our children and
have a
families.
responsibility to prioritize the
We have a
well-being.
responsibility.
Prioritize the
By
well-being.
encouraging the
Responsibility
transition
to prioritize the well-being of our communities,
We have the solution.
clean renewable energy. We have
Solutions
the
that will make
solutions.
things better for
Solutions
all of
that
our
will make life
families.
better for all
Now
of
we
us,
need
our
Now we need
families.
the
Now we need the
political
political
will
will
to
to implement them.
Energy.
implement them.
The solutions that will make life better for
Now
all
go.
our families. Now we need political will. to
Yeah.
implement
Thank
them.
you. Thank you so much,
Wow,
everyone.
that was loud.
Woo! Yes.
Thank you so much, everyone.
Well,
Thank you.
When we
Thank
lead with
you.
our values, that's
Stay
how we
in touch.
win.
We lead with our values. Yes.
Okay.
oh, I better
Thanks.